Hello, my name is Karime Gomez Sanchez, and I will be presenting my career opportunities presentation, which I am choosing to focus on marriage and family therapy. So first, I'm going to go over what exactly this therapy is. So family and marriage therapists are mental health professionals trained in psychotherapy and family systems, licensed to diagnose and treat mental and emotional disorders in the context of marriage, couples, and family systems. According to the American Association for Marriage and Family Therapy, this therapy is very specific in that it's brief, solution focused, and specific with attainable therapeutic goals. These kinds of therapists treat clinical problems such as depression, marital problems, anxiety, individual psychological problems, and child/parent problems. So, how exactly can you pursue this career? Well, we'll start with your education. So first, you will need a 4-year bachelor's degree in order to work towards an MFT career. Some beneficial majors to choose from are in the fields of psychology, social work, or communications, but others are still accepted. You also need to have some necessary skills, which are patience, boundary setting, collaboration, compassion, and organizational skills. After a bachelor's, a master's degree will be necessary. Of the two options, an MA will focus on statistics and research, while an MS will focus on science and counseling. And this is according to the University of Massachusetts Global. In the typical 2 to 3 years that it takes to complete a master's degree, you will gain internship and/or practicum hours where you are working with clients to gain practical experience. And afterwards, you will go through a period of supervised clinical experience that is necessary before you can apply for licensure. Now, next is accreditation. So, as you choose a master's program, you must ensure that the program is accredited by the Commission on Accreditation for Marriage and Family Therapy Education, or the Council for Accreditation of Counseling and Related Educational Programs. The next part, we will start with licensure. So, this is in the form of a marriage and family therapist national examination, which is an exam. Also, each state has specific requirements, so it's important to review your state's guidelines, and you can do so with the link that's in those parentheses. And you can also check the Association of Marital and Family Therapy Regulatory Boards, which is where I have chosen to get this picture that's on the right side, which goes over the steps of your education in order to be able to apply for licensure, again, as a marriage and family therapist. And lastly, even if you do obtain licensure, and that seems like the end step, there is an aspect of continued education, which just means that after you obtain your licensure, in order to maintain it, you need to do some continued hours where you keep up with new research that's happening in the field. So, potential areas of work are in mental health centers, substance abuse and treatment centers, hospitals, schools, and colleges. You can start a private practice. You can also work in employment and system programs, or in community mental health agencies and in higher education. As far as salary goes, the median annual wage in 2024 was $63,680, and this is according to the US Bureau of Labor Statistics. Now I will go over the interview with my chosen professional. So for this, I chose Mr. Patrick McNally, who is a licensed marriage and family therapist. He has an MS in Family and Consumer Sciences with an emphasis in marriage and family therapy, and he is an ongoing PhD student in counseling psychology. The way I know Mr. McNally was that he was a past instructor for one of my CEP courses that I took my sophomore year. So now I will go over a few of the interview questions. So first, I asked Mr. McNally what experience he had in MFT, and he said that he provided individual and family therapy for children and adolescent populations as part of a counseling center in his hometown in Colorado. He conducted assessments including diagnoses and treatment plans for clients. And he also said, quote, I also worked as an elementary school counselor in a local school here in Las Cruces, where I conducted psychoeducational group sessions on kids that were directed my way. I then asked what some career challenges had been pointed in his path. And he went on to say, quote, when you work with kids, it's sometimes hard to see them go through rough situations, and there are times where you feel powerless against families and laws. I then asked if there's anything he would want to tell students pursuing a similar educational and career path. And he said, quote, as you make decisions of what path you want to follow, think about what population you want to help. He also said, as you go through your program, always look for ways to avoid burnout. Next, I asked what skills he thought were necessary to develop for this field, and he said cultural competence is a big one, but also patience. You need to be willing to go at a pace that is comfortable for your client and not just what you want. Lastly, I asked if he had any piece of advice to conclude our interview session with, and he said, quote, I would want to tell prospective students to always take opportunities that come at them so they can test the waters and know if they will enjoy this field. It's a taxing field, so you need to make sure you have the passion needed to stay afloat. Now I will go into the interesting takeaways that I had from this entire experience. So, some new insights. While I was looking for graduate programs to apply to, I did briefly review an MFT program, but I ignored them because I used to think that that just meant you had to work at a school, and I didn't want to. However, now I know that this isn't the only option for workplace settings. I also learned about the similar process between a counselor and a therapist in terms of licensure and certification. I next wanted to compare it to the textbook. And so the career does align with the topics covered in our textbook. Some of the things that kind of resonated with me were mentions of how socialization affects the family, the view of the family as a system that is affected by outside factors, and the highlight of the effects of parents onto children and children onto parents. My interviewees' insights and past experiences reflected the different spaces where a marriage and family therapist is useful and quite necessary at. To conclude, learning about the job prospects of this career allowed me to see the way that this field supports communities and the families that compose them. While I'm set on being a licensed clinical mental health counselor, it's nice to see how many mental health careers there are and the way that we overlap in different manners. And this is either therapists, psychotherapists, counselors, social workers, etc., which is why I included the picture on the right, which just kind of shows how to differentiate counselors from psychotherapists, which is definitely something that I got pretty confused on when I was first choosing a major for college. Here are my references that I've used throughout this presentation, and thank you for watching.